I wanted to ask you, what's your opinion on the effect that the surface has on the injuries that occur when it comes to groin area? I mean, I also work with football players, and I saw that there is a huge impact on where you train, on what kind of surface, on the way that your body responds to it. Can you tell me your opinion? What are your experiences on that, and how does it really, if it does really matter, or it's just fake news?
Yeah, if we look purely from the scientific perspective, what does the evidence tell us? We don't have the clear picture about the impact of surface, so the type of grass or surface, onto the risk of injuries. But from the practical experience, especially in the last two years, we see that there is a clear difference when the player suddenly changes the surface. There is a difference in the interaction between the friction of the shoe, so football boot, and the surface, and this interaction changes the forces that goes back into the body as a ground reaction force, and the ground reaction forces are the forces that moving us in combination with friction. So if you suddenly change that force, change those forces, but maintain the volume of exercise and training, then you suddenly change the load. Mm-hmm. And this change in load can be very, very strong. So for example, I'll take an example. Let's say that our training session is 90 minutes. If I would increase the training session from 90 minutes to 120 or 120, 50, just by chance, from suddenly, I would substantially increase the risk of injury, because the total amount of load that the player is experiencing has been changed abruptly, not gradually. If I would do that over 1 month period, they would not experience so much stress that they would be able to adapt. So my hypothesis is that the similar thing happens when you suddenly change the surface. So the amount of training remains the same, but the stress that the body experiences is probably much higher. Mm-hmm. And due to that, we can have increased risk of, especially the risk of injuries which we called overuse injuries. And these affect mainly the connective tissue, including the groin area, including the tendons, like an Achilles tendon or patellar tendon. So, but it's a hypothesis based on experience. It's not let's say, clear scientific evidence for that.
Mm-hmm. I wanted to also ask you, what was your most difficult case when it comes to a football player or a regular patient in your clinic or in your experience in a football club that you had actually?
Yeah. Well, I only remember cases that I don't treat well. Yeah. The cases that I help, I forgot. So the recent case was actually a groin case. Mm-hmm. And I was pretty confident that I will solve this case, and I failed. But later on, I understood why I failed. So there was also one professional player who had a sudden onset of a groin problem, and this onset was in the club who changed the surface. And besides that player, there were 7 other players during that half season who also had a problem. Now we know from the literature that this is too much for one season for one club. Definitely. So something went wrong over there. I think it is the surface issue, because the coach is very experienced and very, very good. So I approached to every player, and we did a clinical exam. He did the imaging, which showed nothing. He did the ultrasound of the inguinal area, which didn't show any weakness of the posterior wall, didn't show any signs of hernia, but he had an inguinal related pain. And I was treating him for 1 month, and there was I would say 25% of improvement. It was not I was not happy, And I said to him, I really don't know what's going on. I really suspect that it's a problem of the inguinal canal, but we don't have a clear picture. We need somebody who has more experience in that. So he went to the one experienced female surgeon, and she did the surgery, and she said that he didn't have the weakness of the posterior wall as we saw before, but there was an impingement of the genitofemoral nerve, which so let's say the nerve was completely squeezed, and it was not due to the hernia or weakness. It just happened, and it's very, very rare. So when he returned and he told me what happened, then I knew that I actually didn't fail. It was a complex case. But it was very frustrating for me because you don't feel very happy.
Yeah, we do remember our failures.
Yeah, we
as
do.
You said.
But I always try to see why did I fail.
Yep.
I don't stop. I don't give up. Yep. And that's the way how you progress.